Hello, everyone, and welcome to our webinar this month. My name is Chad Erickson, and I'm the Vice President of Strategy at Advice Media. We've got an amazing lineup for you today, and I'm excited to welcome all of our guests. I'm going to turn the time over to Mike O'Brien. Mike is the Vice President of Marketing at Eclipse and one of our partners, and Mike is going to be our moderator today. He's going to introduce all of our guests. So Mike, thank you so much for putting this together and for taking time to do this.
Thanks, Chad. Appreciate it. Well, as we let people trickle in, I'll just kind of give a brief intro to Eclipse and the purpose of today's webinar. First, I want to thank Dr. Vivian Bucay, Dr. Sachin Shridharani, and Darren Seigel with Advice Media for joining us today. We also really want to make a disclaimer before we do get started into the pertinent information that any of the safety and medical guidelines that are shared in this presentation are strictly the opinions of the speakers alone and may not apply to your specific practice. So we really recommend, even though this is meant to be a very helpful content, that you consult the CDC website, you consult your state medical board, and of course, any personal legal counsel or business legal counsel that you have, as well as medical malpractice before applying anything that's shared today. So that's just a quick little disclaimer. But Eclipse, as a device company, it's an interesting time as a company for us because we really just want to provide a way for you guys to jumpstart your practices. And it's not exactly our place to give you the exact instructions personally. So we really felt it was important that we brought in experts from both a physician perspective and also from a marketing and business practice perspective to help you do that, so that you can accelerate the curve in which you want to get back to a successful relaunch of your practice. And so when that happens, Eclipse is successful when you're successful. And so we do feel, though, that our products are really positioned for, I think, a challenging period like this one to be successful and help you shorten that curve. And so if you look at our mission as a company, we pivoted away from more expensive, high-tech items to things that really were a little bit simpler, but also really exceeded patients' expectations. And from an acquisition standpoint, put immediate profit into our customers' practices when we started to use them. And so, we're really all about bringing high efficacy, affordable technologies to our partners across the globe. And I'm thankful to have a very experienced panel of speakers to teach you how to, get back into a place where you could launch these things in your own practices. So, getting on to the purpose of today, though, it's really just to create valuable content to help you guys stay safe and improve your chance of success in the future. In a secondary basis, all that we can really do right now as a company is provide value on our products. And so for those of you that make it all the way through the webinar, we're going to give you a survey at the end of it where you could actually take advantage of a 20% off coupon code for completing that survey. Also, we want to make an introduction to our customer base over to Advice Media. If you don't know Advice Media, they are the experts in helping you develop a business strategy with a marketing focus that drives more patients into your practice and positions you to be successful in your specific regions. And so could not be more thankful to have those guys to partner with on this type of event. So big thanks to Chad and Darren for bringing their team to this. So if you stick through in the end as well, Advice is going to give you an opportunity to connect with them at a discounted rate, which will be another value add at this time. And so at the end of the day, none of this matters unless you can provide peace of mind to the patients and the staff that are coming into your practice right now. And so we hope that that's what you'll be able to get from this particular webinar. So with that, I want to get into just introducing our expert panel. First is Dr. Vivian Bucay. She's a board-certified dermatologist. And there's two things that Eclipse has in common with Dr. Bucay. We're both based in Texas, and you'll see from her bio here that she's a big fan of combination therapy. So we've been preaching combination therapy to help increase your patient's value and results, and we love that that's what she's about as well. So if you look at her training, obviously she's been very well trained from prestigious universities, Johns Hopkins, Miami, Baylor, and she's in private practice in San Antonio. So I called San Antonio my home through high school, and it's near and dear to my heart. And so what more relevant than on Cinco de Mayo to have a San Antonio-based doctor who's also licensed in Mexico. So thank you, Dr. Bucay, for joining us today.
My pleasure. Wow, what an intro. So all we're missing are the margaritas. Next webinar, we'll have them delivered, right? We'll do that. Well, it's a pleasure to partner with you all. I know that I've known both of you all for a long time, and I actually had the pleasure of presenting with Dr. Shridharani in Las Vegas back when we used to have live meetings. So thank you for including me in this powerhouse as well. So I wanted to share a little bit. We just had a soft reopening.
Before you go,
yeah, go ahead.
I'm going to introduce the other panelists.
Oh, I'm sorry. Okay, I didn't see the screen move. Thank you.
Yeah, then I'm going to hand it back over to you. But thank you so much. And Dr. Bucay was early in this from a Texas standpoint. You know, everything's kind of changing by region in different stages. And so one of the reasons we wanted to bring her in is she was really early in really identifying the significance of this COVID-19 pandemic. And even before Texas provided guidelines, she was way ahead of the curve and took steps to protect her patients in practice. So that's one of the reasons we invited her here. Now, I also want to introduce Dr. Sachin Shridharani. He's bringing a board-certified plastic surgeon perspective to this call today, and he's been very successful, and he calls New York City home. And so everyone knows that right now Manhattan is getting hit the hardest right now in terms of how the virus has manifested. And so, you know, of course, Dr. Shridharani has been very well trained from institutions like Harvard and Johns Hopkins, and he's been published numerous publications, and like Dr. Bucay as well, featured all over the podium, all over the world, you know, giving doctors guidance on how to be successful. So, Dr. Shridharani, thank you so much for joining us today. Can we hear him? Maybe your mute button's on. We'll get back to Dr. Shridharani. He'll be presenting later. And then finally, Darren Seigel. So Darren is with Advice Media. He's just a long-time industry expert on marketing, helping practices be successful. And so I've known Darren, I think, since 2012 when he came and gave some tips to our company on certain ways we can create value for our customers. And I reached out to Darren after they created this COVID-19 comeback plan. I thought, that is way more valuable than any device company can put together on our own. So we would not be able to do this type of event without advice. And what a more relevant name for a company at this time when we all need advice on taking next steps. So appreciate Darren. He's going to be bringing it home for us with some really good content on how to improve your business practice and marketing.
Thank you, Michael.
Awesome. So with that, I'm going to hand it over to Dr. Bucay and just let her roll. She's got some great information for you guys. I think you're still muted, though. Go ahead and unmute.
There I am, unmuted.
There you go.
There we go. So practical business steps in reopening. And yeah, we have been closed since mid-March, and it was hard to make the step to close when everything seemed, you know, business as usual, but that's exactly when you have to implement things. You have to be ahead of the curve. You don't wait to be reactive, you have to be proactive. And so for those of you on this call that haven't reopened yet, it's an opportunity to do things, to prep for this. Start getting, start ordering your PPE and disposable supplies in advance. Luckily, we kept what we had, and we didn't have N95s to donate to the front lines, or we would have. But that is one thing. The other thing is, I have to say that I'm part of a group of dermatologists. There's 20-some of us on there, so we've stayed in constant contact. We're scattered throughout the entire country, and so we would send each other helpful hints. So ordering air filtration systems, I hadn't even thought about getting additional air purifiers until it came up in conversation. And because one of my offices is in a medical office building and air is recirculating, I can't vouch as to what might be circulating through. But there's a plastic surgery practice in that building. There's pediatrics, there's orthopedics, there's oncology, there's a huge radiology practice. So a lot of the practices actually were open, although we were closed. So I went ahead and ordered some air purifiers, and they're on their way, and for both of my locations. And what they can do is, in an area that's 400 square feet, which is larger than most exam rooms, depending where you are, in the country, it can renovate the air, if you will, within 15 minutes. So, as soon as we see a patient, we could just put that, let the purifier keep circulating out, and it filters out to 0.1 microns. Anyway, I looked at different ones with the HEPA filters and everything, so that's just something I did. Got to go digital now. We've already had digital in our reception areas, but we do have a lot of print media. So, brochures, or if I've been featured, giving quotes in a magazine, of course I'm going to, share that with our patients and staff. So that all has to go away. Anything that can be touched, that's a common touch point. In fact, the other thing, and I was reading a handout last night, another set of guidelines is if you have, we all want to provide a luxury experience. So if for any reason you're going to be using your reception or lobby area, once you do decide to reopen and practice social distancing, everybody's going to be different. Not everybody has a car where they can be waiting in to be called in. Then I would advise that you also remove things like coffee pots, water bottles, things that might be touched by more than one person, so that you keep that area safe as well. Update your consent forms to include language related to COVID-19, and you might consult your malpractice carrier or your attorney. One of the things that was interesting when I was deciding, can I be practicing? Can I not be practicing? I know this came up in everybody's minds because, we've all learned as physicians, first do no harm. I was really puzzled, and I didn't have really good clarification from the Texas Medical Board, and then the Texas Derm Society, would then interpret what the Texas Medical Board was saying, who was then interpreting what the governor was saying, and then everybody had a kind of a little caveat that none of this construes, medical legal, illegal advice. But I actually went to the malpractice carrier, the one we use, and looked under FAQs, and it said that we were covered even if we were practicing in times when it was recommended not to practice. So you can always ultimately go to your malpractice carrier and see specifically in your situation what that might, entail. What about serology testing? I mean, there's so many different kinds of tests. Some of them are not FDA approved, some of them are. Do we want to find out who's immune? I mean, of our staff personally, and we're 17 total, no one has had COVID and no one has had direct exposure to COVID that we know of, but have we been serologically tested? Not everybody has. And that's also because it's been hard to get that testing. And also when you get serologic testing, know that even if it's negative, and we're talking about IgM and IgG antibodies, we're looking at immediate and then long-term immunity, they could be negative and one could still be incubating. So that's not a total safe way to go. So of course the nasal swab is the preferred method, but those have been in short supply, and honestly trying to leave that for frontline workers or those at highest risk. Also based on results. I mean, if you allow somebody to come back to work, what is your liability that somebody could say? So it really varies. I wish I had a solid answer for you, but I don't. Let's go to the next slide. Go next slide.
There we go.
There we go. All right, but one thing we can do, I run notoriously behind schedule. I have the disease to please. A patient might be coming in for a neuromodulator, and all of a sudden it turns into filler, or they want to discuss a skincare regimen, and I have a very hard time telling somebody no, especially because we're very, very privileged to have patients that come from all over the country and sometimes other countries as well. So once they've gotten there, it's really hard to say, no, sorry, you have to come back another time for that. But in this situation, as much as we can, let's do some telemedicine. And that's something that I may even implement ahead of doing cosmetic consults, because I typically do cosmetic consults in person. I may spend 20 to 60 minutes. Patient may not even have a treatment at all. Most of the time I charge for that visit, and then may or may not apply it to a treatment, but that's all individualized. But at the same time, this might be a really good time for reinventing how we do things and streamlining. And I may start with doing some telemedicine consults that then can, when the patient is then brought in, be brought in for treatment. And that is something we're doing right now. A day in advance, we're going to make sure that the patients know exactly what they're coming in for, because we only want one patient in the office at a time per provider. I hate the word provider, but let's say per physician, esthetician, and they should not overlap. Also, I live in San Antonio. This is an area where people still have their extended families, and we tend to do things, and we like to party in clusters, dine in clusters, do everything, very much a sense of community. And this is a time where you just can't be bringing in everybody. And, we all have those patients that come in with their sister or their friend who's just going to watch. And what that they're really doing is checking out if that's something that they want for themselves, a treatment. And it's a nice way that, when you allow other people in, you're in essence also kind of selling. But right now, it's got to be limited, got to limit the traffic. So we are letting people know in advance that if somebody is coming in, they're the only one that will be admitted to the practice. Now, that said, if it's somebody with special needs, we're seeing a medical patient at one of our other locations, the one that's more equipped to handle that, then there's a caregiver, then the caregiver is going to be screened as well. But the fact is, everybody gets screened when they come to the office. Schedule fewer patients. It's painful because right now a lot of us have suffered some economic losses. Some may or may not have gotten that payroll protection program loan, and trying to figure out, you're like, okay, I can open now, I need to make up for lost time. But that's not the way to do it. All you need is one person to then say they got COVID-19 at your practice, and that's it. They're going to let everybody know over social media. So one thing is schedule fewer patients, but you can also alternate in-office visit with a telemedicine, in-office with a telemedicine. And so you're still keeping up a nice flow, and at the same time not being as behind in getting caught up on your backlog of patients. Also, you can stagger your staff and people that are providing services. So maybe a receptionist, one might come from 8 to 12, another might come from 12 to 4, or from 11 or 11 to 3, and do that way. Because if you don't have all of that huge flow, still a lot of patient flow, you may not need everybody. Also consider that if you really don't need an assistant to do an injection, a neuromodulator injection or a filler injection, and you can do it yourself, just the less people in a room, the better. And
Vivian,
yes,
Dr. Bucay,
yes.
you said when you bring in the family member, they're going to be screened also, but you didn't mention how are you screening?
Thank you for pointing that out. So we do the same thing, questions. Where have you been? I didn't know if Dr. Seigel was, if he was going to cover that or not, or that way, but taking temperature, asking the questions. There's some guidelines that you can get from the CDC, but I also encourage people to go to their state, local. I thought I mentioned that in one of my other slides, but basically want to take temperatures. We're going to ask those questions, check for signs. For staff, every day we're keeping a log of that, and we're going to have staff initial next to their name that they were not in contact with somebody, that they themselves haven't been coughing, sneezing, having extreme fatigue. Big one to put in there in your questionnaire, of course, is that sense of that loss of sense of smell, right? The anosmia. That wasn't an immediate symptom, but that's another screening question. Loss of taste and smell.
And this is on your next slide. My apologies.
That's okay. That's all right. So we'll just making me go through, a little bit. Also consider where your office is. One of my office where I'm actually sitting right now is an exam room that's really huge. That will need longer to, for the air to circulate out. And it's it's 2-story historic home, but it's freestanding. So I can pretty much control the flow, who's coming in or out. I forgot to say, lock your doors. When a patient texts it, then I'll put that in. You control who's coming in. We've let our staff know that, if a rep wants to come by and talk with us, they're going to need to schedule an appointment, and hopefully, that's assuming their companies have allowed them to do in-office visits, but we can certainly do FaceTime visits and, figure out creative ways. Industry partners are so important, and we've all been in this together. You all have been great about reaching out and making sure everything is good. And so I think that's, those are relationships that can only be strengthened and should be strengthened over time. But at the same time, we can't have a lot of people coming in, because again, the risk will go up, and we'll start to see peaks again. So if you're in an area, if you're in an office building, if you're on the very, very top floor, it might be different than if your office is in the lobby where people are coming in and out. At the medical office building where I do have my other practice, I happen to be not just on the first floor, but I'm by one of the entrance exits. So more people even walking by our door. On the other hand, nobody has to take an elevator to come in. So those are the things. Let's go to the next slide. Oh, that was the next slide. Go back again. Sorry, can you go back a second? Okay, so what I wanted to say is that when patients arrive, they're going to text or call us and let us know that they're there. And when we're ready for them, member will go to the door, let them in, and make sure that they're wearing a mask. You know, it's very mixed about, people have very mixed feelings about wearing masks, and I'm certainly not going to go into any, you know, political discussions, but the primary purposes of mask is to ensure the safety of others, not to keep yourself safe. That comes secondary. So the patient needs to be wearing a mask because I don't know where they've been. If they refuse, then I actually have the right to refuse seeing them. If they arrive without a mask and I decide that I'm going to see them, then I am obligated to provide a mask before they come in. So you might think about having masks that are very accessible, maybe a box near an entry point, so that you can provide those. So that's just another tip that way. And that guideline I just told you is specific to Texas, because I went in again to the FAQs because it seemed contradictory. Number one, you're not obligated to provide a mask. Number two, you can refuse service to somebody not wearing a mask. So yes, if you don't have enough masks or things to go around, then you can refuse service if somebody's not going to comply. But at the same time, if you agree to see them, then you must ensure the safety of everyone around you as well. All right, next slide, please. So pre-screening, that was the next one. So when it starts with the scheduling is so important. It's really, really important to have your staff up to date. We created a chat group on WhatsApp, which happens to be encrypted, of one chief, administrator at each location, office manager, and our CFO, my associate, Dr. Bandari, and myself. So we had ongoing communication every time about things that were going on, and we could chat at any time of day or night. You have to post the guidelines and measures that are being taken by the practice to protect both staff and patients. This is also in Texas. You must post, but I'm pretty sure this is across the country. You have to post in every room. And why not? Patients want to be reassured that you're cleaning, that you're screening, that you're doing everything possible to make them feel better. Hey, we're in a field that we're doing elective procedures. They're not quote essential, but sure, they sure do make us feel better. And now that a lot of virtual things are happening and virtual weddings, I saw a commercial on TV last night. One of the jewelers was talking about, let us help you prepare for your virtual wedding, right? I mean, industry is adapting. Everybody is adapting to this current normal. And so it's important to let that staff know let the patients know and be reassured. So you've got to post that in multiple areas. But do check with your state, local and state, national, also the medical societies, right? Because for me, it's important to check with the American Society for Dermatologic Surgery, the American Academy of Dermatology, checking all of that. And there's actually some great publications coming out. I can't really show you that, it's not going to come out, but I just received this from one of my friends, and this is called A Path to Resume Aesthetic Care Project, ACERT guidance. It's going to be published, and I will tell you where it's going to be published. It's going to be published in Facial Plastic Surgery and Aesthetic Medicine, and it's a project collaboration between plastic surgeons, dermatologists, epidemiologists, ranging from Harvard to Stanford, and guidelines and best practices across the country. So another way that's only 63 pages long. I got it after I kind of prepared this, but I was happy to see that I was very much aligned with what they were suggesting, and I'm certainly not going to steal thunder from my co-panelist on this. But again, check that, taking those temperatures. We do a lot of signing, I was pushed into doing everything telemedicine, et cetera. And we have, for example, TouchMD, our screens to show befores and afters. We use Emma. I'm not plugging anybody. I have no financial interest in any of those. We use Emma for our telemedicine. But that's where our consents have been. Well, nobody can be touching those iPads multiple times. So I'm just going to have those little covers that I use on my hyfricator and put those on a stylus for e-consents or for anything that requires. If I can do touchless checkouts, I prefer, to do that. And instead of going to an area to check out where people might congregate, which we hope they're not going to anyway, we can consider doing our checkout and doing scheduling the follow-ups within the whole exam or treatment room that way. Can I go to the next slide? I'm just about done. Your administrative staff has to wear face masks as well, and it's at least at the minimum a 3-ply mask. They can keep the same one on, the admin can, during the day. But if it's your clinical staff or your providers, those need to be, those have to be kept on all day. Patients, if they can wear a procedure, if we're doing a procedure, they should. So for example, if someone's doing a body contouring treatment, something that isn't touching, not even involving the face at all, or let's say we're doing injections elsewhere on the body, patient needs to keep the mask on as well. Try to keep physical distancing rules, and I do prefer to call it physical rather than social distancing. I said that from the get-go, and sent that out because it's really important that people not feel that they're isolated. I mean, as it is, this is a very isolating situation right now for those who don't have family and friends, at home, and they've been completely, in a basement apartment or an apartment somewhere and really can't get out. Or don't even have a car where they could just escape and go out for a drive in the country. It's been a tough time. So if you're in an exam room and let's say your room is smaller, maybe that's more so in certain areas of the country where real estate's at a premium. If it's less than 6 feet, where make sure you've got those masks. So like for my staff, my admin staff, there's one area where 2 of them are probably within 6 feet of each other. Where we changed that, only one person's going to be in there, or if they both must be, which they're not because we're staggering, then both should be wearing masks. But make sure that you ask patients to comply. If you're doing in-house events, with Mother's Day coming up, this is one of our big times what we like to do. It's also like Teacher Appreciation Week here in Texas. Maybe it's across the country. It's Nurses Day. Tomorrow's National Nurses Day. All of those things that, where we do lots of appreciation and there's a lot of interaction, those are going to have to go to, kind of virtual, live events online. And, we're going to be better later on, and we're going to be able to get back and so much more appreciate that. But it's time to make, to really use those virtual platforms as much as you can. And try to do low or no downtime procedures. I love doing chemical peels. I mean, dermatology, that's one of the things we do is we do peels, or we do like CO2 laser resurfacing. Anything that requires that the patient be touching their face a lot. Especially now that they can go out now and go to the supermarket or go back out, it might be irritating to wear a face mask afterwards. The guidelines I saw said that you could do these procedures, but to ask patients to wear a mask, I'm just thinking in terms of practical terms. I know that I've had more breakouts and more skin irritation on the lower part of my face during this time where I've been wearing masks a lot. And so that's just one of the things, think about it. Try not to do things that cause vaporization on the skin, or or particles that get on the hair. If not, they need to be wearing caps. I mean, if you have to do a procedure that causes aerosolized particles, then you need to have those extreme measures in place, and that includes N95, gowns, caps, etc. We practice for now. We're not going to be doing laser hair removal right now, because again, these particles can get on multiple surfaces, and no matter how much you're cleaning, they could also land on patients' clothing, and maybe they went home and didn't change immediately, or you didn't change immediately. So there will be time to implement and expand as we get to these procedures. I read interestingly that if you're going to use one of the devices, which I love, like the Zimmer with the cold air that we use for resurfacing or during PRP or injections to decrease that needs to be, that's a special consideration, because you really are blowing cold air out and possibly dispersing particles. So their recommendation has been to use an alternate means of discomfort control. Sorry for that. I was trying to find the word. I hate to use the word pain, but try to find a way to do that. So over communicate with your staff and patients about what you're doing. This is a time. You're not going to beat a dead horse here. Over communicate, acknowledge to patients. I always thank them, even in good times. I thank them for choosing us, and I always want ask them what they want to accomplish. Be really sensitive to people's concerns. What measures you're taking. We have an extensive background knowledge in medicine, but don't assume that everybody else does. And we have a lot more diagnostic tools. So the tools and tests that we have, use them. Use what you can, and you're gonna know what's appropriate for your practice. Information travels really, really quickly these days. So take advantage of that, but also know that information can also be used against you. So make sure that people have a really, really great experience, and keep your messages, short and sweet if you can. I'm notorious for being wordy, as you can tell, and all of that, but try to keep those communications out, even if it's just a, hey, how are you? Thinking of you. Just know we're doing everything we can to make your experience a safe one. It's not going to be the time where I'm chatting a lot with patients and using talkathesia, to get them to be more relaxed, because every time we talk, we're also, more chance of dispersing particles out there. So, and remind everybody that social distancing has really, really helped, and that things could have been worse. We also know they could have been better had we started physical distancing, measures sooner, but they could have always been worse. And what we want is to be going in that positive direction, not to be backtracking, not to be going in circles and having to start over. So my big, big message is keep these measures in place while being able to work, while being able to provide services for your patients. But remember, the safety of your staff is really, really important. They're the team that's going to help you reopen, and they're always, they're number one. We're there to serve our patients, but we can't do them at the cost of damaging our own practices. And I want to thank you for tuning in.
Thank you very much, Dr. Bucay. Incredible information. And as Michael said, I also live in Texas, although we're based in Park City, Utah. Dr. Bucay was implementing these measures before we had our shutdown in Texas to ensure the safety of her practice, her patients, her staff, and really, really wonderful information. We're now going to go right into Dr. Shridharani.
Hey, Darren.
All right. Hey.
So
good.
First and foremost, thank you guys all so much for having me on. Mike, congratulations with all the great work your company is doing. You gave me a very nice, warm introduction, and with all that education, you would think we could get a webcam to work, or I could get the webcam to work. So I'm deeply apologetic sitting here and, Sunday's finest, so to speak, but you'll have to just play it out with the voice. But Vivian, always wonderful to collaborate. We get a chance to do this. It happens all too infrequently, unfortunately, and maybe this will be the wave of the future, as it might be a while before we get to do stuff in person together, but that was just fantastic. In recognition of all that great information, I might just be able to hang out for the next few minutes and drink my margarita, because you've already covered so much great ground. And of course, Darren, thanks you guys for helping co-host this. I've had the fortune of working with you and MyAdvice Media with all the great work you've done to help us grow our practice here in New York City. So as Mike, you mentioned earlier, I'm a plastic surgeon here in New York, and we have experienced, things that, one probably could never have imagined, slowing down what is viewed as truly the city that never sleeps. There is a lot of activity going on here with respect to the unfortunate nature of how rampant the disease is and how much it's spread. It is all about the curve, trying to flatten that curve, get ahead of the curve in all these different efforts. And certainly when we have the fortune of reopening, which is on the horizon in New York, we are going to need to implement so much of what Dr. Bucay already mentioned. I think what's really going to be fundamentally important is implementing these measures that impact other industries. If we look at it from the lens of airlines, restaurants, things where people flock to in the hundreds to thousands to millions on a daily basis, they're leaving those areas and then coming right to our offices, or at our offices and then going straight to those types of vicinities. The way we travel will never be the same, and the way we practice medicine will never be the same. If you're going to be on a plane, they're boarding people 10 at a time, and it takes forever, and that's just the nature of the beast. And we have to be prepared in our practices to tolerate and to also help our patients understand the critical nature of how we are going to be impacted as well. Vivian made a lot of great points. There's nothing to really contrast from a surgical lens, but rather just complement it. We are seeing so many different elements in the elective surgery arena, where patients are likely, then again, the regulations and mandates and recommendations are changing on a daily basis, but there's a high likelihood that everyone who's going to be undergoing elective surgery will likely require a COVID-19 antigen test, which are the tests, of course, that have been in significant shortage. But now, in order to resume doing elective cosmetic surgery, you're going to have to track these down. So for us, we have our own OBS, or office-based surgery facility, and really, have made that a pivotal part of our practice with how we take care of patients. And the experience we provide at Lux Surgery is a luxurious experience. Well, people are going to need to come in X number of days in advance. We're going to need to get them COVID antigen tested, get hold of kits, because the blood test, those antibody tests, will not necessarily suffice as someone who's obviously currently and actively infected. So thinking through the logistics of who's going to perform that test. Right now, it's still that oropharyngeal swab or nasopharyngeal swab test. They haven't released the saliva test, which is on the horizon, that is supposed to have high sensitivity and specificity. But now you've got to have someone in your office staff, stick these swabs in the back of someone's nasopharynx, where they basically now are going to aerosolize throughout a portion of your office. So now you need to otherwise tell your elective cosmetic patient to go get screened at a hospital or a different urgent care center where sick patients may already be. These are some really important logistics to how one is going to keep themselves safe, help your patients get the right testing, follow the mandates, and still be able to generate revenue and take care of your patients and operate in your offices again. There's special filters that are required on your ventilators, on your anesthesia machines, that one's going to probably find that could even go into shortage. So you have to have separate filters. Everyone talks about the HEPA filters, of course, for the air, for the actual filters on the planes or through your offices, but there are separate virus type filters that they want 2 filters now placed for every case on your anesthesia machine or on your ventilator. So looking at the overall increased amount of costs, planning ahead, recognizing that there's going to be a lot of logistics is also very important for our surgeons that are on the call, or for our other individuals that are on the call that happen to collaborate with surgeons as well. Other safety considerations also happen to be during the intubation and extubation phase. So fortunately, if you're able to get a patient, of course, tested and they're COVID negative, that decreases some of the issues that one may have. But otherwise, there's a recommendation of likely waiting at least 20 minutes after intubation, or even prior to extubation, or excuse me, after extubation, and removing certain number of people out of the room to only have maybe the anesthesiologist and one person to assist if there was an issue, and waiting a requisite amount of time of 20 minutes or so for anything to settle prior to starting the case. So there are a lot of very important considerations that impact your surgical time, anesthesia time, logistics, testing in the office, exposing staff to people that could come back COVID negative, increased responsibilities for reporting this to the Department of Health and epidemiologic individuals. So I think recognizing that the impact of this and the toll is quite high. So if you expect to open your doors in that first few weeks, so everyone's got patients in their practice that are just chomping at the bit. Vivian, you guys have a very robust, sizable practice. Same thing here, where our team is just getting inundated with calls. We'll see this initial surge of people who've been just waiting to kind of look good again, feel good again, reemerge. And then we may see a lull because of the economic impact, which we'll get into in a moment. Point is that opening the floodgates and just letting everyone come in is likely not going to be the solution. I echo what Dr. Bucay already mentioned earlier about being sort of mindful and respectful of the fact that we're going to need to have more of a comprehensive approach to allowing patients to come in and limiting your overall number of patients so you can turn over that room. You can go ahead and completely sterilize equipment and get everything set up like you may not historically have had to because of a decreased risk. So those are just some surgical safety concerns. As far as expectations, I think there's no question that we're preparing internally for our surgical volume to be impacted. We have a huge backlog of patients that weren't able to get surgery over the last few months because of all of the appropriate mandates. However, I think also recognizing that these are slightly higher, more expensive, or higher ticket item, more expensive types of procedures, individuals may be a little bit more apprehensive about shelling out that much money when there's so much instability at work right now or employment. So setting the appropriate internal expectations, I think, is also going to be paramount, which we're already doing in our practice, and recognizing that 2020 is going to be probably a little bit of a more financially duressed year across the board in most industries. Also, looking at expectations with recruiting staff back. I think we had a couple of pre-meeting calls. We were very fortunate in our practice, and I know our staff is. Dr. Bucay, you as well mentioned as well. We've been all very fortunate to hold on to our teams and our staff members throughout this process, but a lot of very dear friends of mine and colleagues have had to make some really, really tough decisions about furloughing or firing and kind of reducing their overall staff. So what does it look like now to bring people back, to help them understand maybe that it wasn't anything personal and it's just what the practice or the business had to do in that moment? I think more now than ever, empathy and having a more team approach and having elements of sort of reflecting and validating, which sometimes as surgeons we're not always known to do, is going to be so important, because it takes that team to obviously take care of the patient. Vivian, you ended your statements with that, already stating that obviously we want to take care of our patients, but need the responsibility from our staff. I couldn't agree more with you. Do you have some thoughts as to how you're going to ease everyone back into the practice in that respect? Any comments or thoughts before I get into my sort of top 5 things to expect?
No, I completely agree with you. Everything you're saying is, we're on the same page, so nothing to add. Keep going.
Yeah, well, thank you. This is why we always do such great stuff together. We drink the same Kool-Aid. No, but I think these are all important strategies. And I think probably one of the biggest elements is just to reflect for a moment and recognize that we are very fortunate to be in the positions that we are in medical care. Darren, if you'd be so kind to go to that next slide for me, that would be really great. It really kind of piggybacks into what I'm thinking about, sort of the top 5 things to recognize in aesthetics right now. So first and foremost, we know that there's going to be an economic impact. However, over time, things will bounce back. I think even though the pandemic is very different than the global economic recession of 2008, that's sort of the most recent thing in memory that we have where there was such a huge impact left on the world. Right now, I recently read an article in Reuters that in the US, there's about 18.9%, so nearly 20% unemployment amongst the 180 some odd million individuals in the US that can actually work. US populations in the 300 something million, plenty of people below 18 and well above 70 who may not be working or considered in that normal working group. So we know that things are not going to be the same right away. And I do think that even though the world economy at that time was crippled and aesthetics did suffer, there was still an interest in undergoing treatments, and the individuals undergoing those treatments definitely ended up surging and eventually eclipsed those pre-recession numbers, but it took time. I really think feel the boom of sort of less invasive and slightly more affordable options like our injectables, our skincares, laser treatments, things that maybe not all surgeons adopt. We've been big on that in our practice from the get-go. Darren, you know that as you've helped watch us grow over the last nearly decade. These minimally non-invasive treatments will hopefully maintain that youthful appearance and certainly will be options to help people attain a good feel more than just surgery. So there's going to be an impact. It does take time to recover, but throughout that process, injectables, even throughout the 2008 financial crisis, continue to actually grow in their numbers. It just wasn't at the same rate as before. We talked briefly about staffing and staffing changes and what the work has been done to build a team. Again, during this time, even if you're getting ready to reopen, we've continued to do unique things in our practice to keep the team sort of connected. More than half of my team is sort of dispersed to going home to be with their families, but they're still working remotely. We find tasks for them to do. Once a week, we're doing a team mindfulness session or just a call for everyone where we don't talk about anything office or work related, but just get everyone on board for a half an hour, 45 minutes, because there's something so different about just connecting on a call versus actually seeing them. People are at home, they're comfortable, relaxed. I mean, I've never seen the inside of probably any one of my staff members' homes before, and now all of a sudden you've got, they're sitting in their living room or their bedroom and comfortable. And I think that's really important. I feel that the way that we communicate has evolved. Look at what we're doing right now, minus the fact that you can't, see me, of course. This is going to leave a lasting impression on our disciplines. We're going to pivot very quickly. Telemedicine and telehealth has been around for a while, but it really never totally took off to the way that people wanted. And now it's going to be basically mandatory. We're figuring out how to initiate, all the consultations, patient expectations of those consults. How can we effectively communicate with our local patients? We've been doing it for the last 6 years for all of our international and out-of-town patients in New York, but now people that live 2 blocks away, rather than just being like, I'll just come in and have you take a look, we don't have the luxury of just telling them to come in at any time because of obviously some of the issues. So getting your team facile on these platforms is going to be important. I look at it from the lens, I had a conversation with my father, who's a retired cardiologist. They used to have foot traffic of a few hundred patients a day coming through their office with him and the associates that he had hired. And I said, if this went on during that time period, how would you have been connecting with, people? And he's looking at all the technology, how our phones are constantly going off. We're getting, DM'd on this platform and on Instagram and Facebook Live, and you got to share information here. This isn't HIPAA compliant. This is HIPAA compliant. FaceTime isn't encrypted. WhatsApp is, but then it's not HIPAA. So all of a sudden, there are so many different avenues. You need to get people in the practice to understand what is safe and legal in your area. Crossing state boundaries and state lines, so to speak, with medical licensure is important. You can't just render medical opinions with anyone in any country at any time. There are rules and regulations that are going to be enacted because of all the way that we're sharing information. Finally, or kind of fourthly, we know that we really love what we do, and we'll get it back to it. Aesthetics is an industry that is always evolving. It is exceedingly resilient. Everyone talks, or people talk about that lipstick index famously described by Lauder for the Estee Lauder family. And he basically described that during times of economic turmoil, you saw often lipstick sales increase, meaning that people will decrease what they spend on certain elements and complement it with our other ticket items because people still are going to want to look good. We're fortunate to do what we do. We've got to be innovative and pivot very quickly to stay relevant. And I think finally what we know is that we really know nothing, right? If we know anything at all, it's that we've had our lives impacted by something that we literally can't see with the naked eye. So the brightest minds of the world are trying to figure out ways to keep us safe and keep patients and families and everyone we love safe. But fundamentally and ultimately, things are changing, and tuning into things like this that, again, Mike and Darren, you guys have been so great to put on, is helpful, because what we say now may change with mandates on what the expectations are pre-surgical in 5 to 7 days. So we just got to stay up to date and recognize that over time, this too shall pass.
Could not agree more. Thank you, Dr. Shridharani. I think that's a good point. It's a very humbling situation. A lot of people are drawing comparisons to the most recent sort of major event that we remember, the financial collapse. And in many ways, this is so different for those of us that were in the industry back in 2008, 2009. I think Darren's going to hit on those points. So you're just joining us. I saw some attendees just kind of picked up midway through Dr. Bucay and then midway through Dr. Shridharani. We just heard from dermatology perspective from Dr. Bucay, and then also a plastic surgeon's perspective, both in Texas and New York, respectively. And so if you didn't catch some of their talk, send a little question or let us know in the chat area. And if you do have specific questions for either Dr. Bucay or Dr. Shridharani, make sure that you put their name on that question that you put into the chat box. And we're going to get to those questions at the end. We'll do a little Q&A right after Darren gives his business development and marketing perspective. So if you do have questions, throw them in there. And if you can, just make sure you direct them at the person you want to answer that. So Darren, go ahead and take it away.
Thank you. Thanks a lot, Michael, and great job, Dr. Shridharani, and thank you, Dr. Bucay. And Dr. Shridharani, I've known Dr. Bucay for a very, very long time. She's always been, as long as I've known her, a key opinion leader, incredible speaker, incredible businesswoman. Dr. Shridharani, I first met when he was in fellowship, and I've never seen anyone grow a practice like him. And if you ever get a chance to go to New York and tour his office, it's really just a lesson in how a place should be operated and run. His ideas are invaluable, and I hope you take them to heart. So
we'll have to orchestrate virtual tours these days, but absolutely.
I know.
I'm going to visit.
So at Advice Media, we've been very fortunate through this. We haven't had to furlough anyone. We've healthy cash reserves, and we're very lucky in that our executive team is filled with some brilliant business minds. We have multiple Ivy League MBAs. I'm an attorney. We have business school graduates. We have Six Sigma person on our team. And when this first started, we really tried to put together a plan to what were the most important things we need to focus on. And then as we got into it, we realized this is something great for not just our customer base, which is over 2,000 practices, but for anyone in business. And we put something together, and we have a wonderful document, which we will share with you after this. But this is going to be a synthesis of some of the ideas and something you should really think about. So I'm going to jump right into it, the 5 things that we're going to get into. The first one is setting up a mission statement of values. We work with a company called Becoming Your Best. Steven Schallenberger wrote a great book. And he says, when you have a clear, compelling mission, you transform the effort of the conversation and results of your organization. Right now, 75% of employees feel disconnected from their work. Imagine that, 75 people, they don't feel like they're part of the bigger organization, like they're part of the growth, like they are part of the future. They feel like they are just cogs in the wheel. And you're never going to grow, you're never going to be successful if your employees feel like that. And a mission statement is critical to getting people on board. And I can tell you, when we first did this, I thought this was totally worthless. I did not see the value in a mission statement. We just got to work hard. That's what we just work hard. Once we did it, and we got together and created a mission statement, it totally transformed our company. Everyone in our company knows our mission statement. Everyone knows our core values of our company, and everything we do revolves around that. So the Dalai Lama said, in order to carry a positive action, we must develop a positive vision. When you are creating a mission statement, it needs to be clear, simple, easy to remember. You want it to be no more than one sentence. If it's more than one sentence, people are not going to remember it. Make it very, very simple. And I'm going to give you some examples of some great ones in a moment. It gives you and your employees direction, purpose, and inspiration for everything they are doing, every action they're taking, every reason to come to work every single morning. And encourages the alignment of principles and efforts, which is so critical to having a successful practice, getting your whole team on board with your common mission. The ultimate desire that is going to drive your goals. And if you want to succeed, if you want to grow, to have a successful practice, you need to get your whole team on board. So here's some examples of some wonderful mission statements. First of all, Southwest Airlines, which I fly a lot. We operate with a warrior spirit, a servant's heart, and a fun living attitude. And if you've ever flown on Southwest, it's a great airline. You know that's the vibe that they have. It is a fun vibe. They do things right. I was actually having dinner last night at a friend's home who is a United pilot. And even when I mentioned things about Southwest, he never would put down Southwest. He would put down American or Delta or any other airline. He would tell me why they're bad. Southwest, he knows it's a great airline, and this is coming from a United pilot. Nordstrom, to give customers the most compelling shopping experience possible. Another great one, if you've ever had experience at Nordstrom with anything that's gone wrong, you know that that is one of the best customer service organizations on the planet. But these next two, I think, are very, very telling. When Microsoft first started, their mission statement still is a computer on every desk and in every home. And Google was organized the world's information. These were startup companies, very, very small. Well, look what Microsoft did. A computer on every desk and in every home. Today, It's not just on every desk. It's not just on every office desk. It's not just in every home. It's in your pocket. Who would have thought that? Google, organizing the world information. We don't look things up anymore. We Google things. We ask our phone. We ask Siri things. These were lofty goals, lofty mission statements for tiny companies that changed our planet. At Advice Media, we spent a lot of time figuring out our mission statement to make our clients' lives better by supporting their professional and personal success. Every employee memorizes it. It's on most of our documentation in our office. Chad walks around the office sometimes and just asks employees, can you recite the mission statement? He even walks into meetings and says, I'll give $20 to the first person that can recite the mission statement. It gets everyone in line with what we're trying to do, makes them feel part of something bigger than just their role. But it also makes them understand that their role is critical to us achieving our goals. So what do you value? These are things you want to think about. What is important to you? What matters to your organization that is going to help it succeed? So for us, and you can come up with your own, you want to spend some time coming up with them. We came up with 4. You don't want any more than 6, really. We thought 4 was a good number. Everyone can remember these. These are on our coffee mugs, they're on our t-shirts, they're on our biking shirts. They're all over the office. The transparency. We're going to be honest and accountable in everything we do. Everything in our company is open to every other employee. Everyone sees the numbers. Everyone knows what their effect is on those numbers. So they don't feel like they are just doing nothing. They can see that they have an effect, and their effect, what they're doing, affects the entire company. The only way people are going to want to succeed, if they're going to want to hit their goals, is if they know what those goals are and they know what the effect is on the company. Relentless effort. We will never say good enough. Always strive to be better. When you walk into our offices in Park City and in New York, and we'll probably put it on our new Colorado office, on the wall there's a quote by Vince Lombardi. It says, we will relentlessly chase perfection, knowing full well it cannot be achieved, but on the way we will catch excellence. Again, always be striving for better. You're going to come up with your own, but these can help you get started. Teamwork. We will work together, recognizing that we are powerful and accomplish great things when united. As I said, we've been very fortunate through this to not furlough any staff, to be in a good cash position. The only way that happens is with everyone on our teams being on board with our mission statement and our core values. Finally, intellectual honesty. We make decisions based on hard data and facts, and I'm going to get more into this in a little bit, or removing personal information, emotion, and bias. The numbers are the numbers. The numbers speak for themselves. So you have to know your numbers. Thomas Monson said, when performance is measured, performance improves. When performance is measured and reported, the rate of improvement accelerates. And we all want accelerated improvement in our practices, especially coming out of these lockdowns. So for you, one of the most important things to understand is, what is the lifetime value of one of your clients? Lifetime value is the average transaction plus annual purchase frequency plus the expected years of the relationship ends up with customer lifetime value. You need to know what a customer is worth to you, not just for one procedure, unless you have a practice where something's only coming in for one procedure, but when you're in aesthetics, lifetime value can be tremendous. The American Society of Aesthetic Plastic Surgeons said the lifetime value of an aesthetic patient is anywhere from $90,000 to $120,000. It's a staggering number. When you think about it, you realize how important it is to not only gain patients, but to maintain your relationship with those patients. So what metrics are you measuring? And I'm going to give you some that we think you should be measuring that are critical to your office. First of all, your lead response time. When someone calls, when they email, when they have a chat, how soon are you getting back to them? Statistics show that if you wait longer than 10 minutes to get back to an aesthetic patient, your chance of converting that patient drops by 50%. So what I always tell people, my clients, is when somebody emails in, the next time their phone rings, it better be your office, because they're probably calling, they might be chatting with someone else. That person may get back to them, or they may just cool off. And we all know that these are emotional decisions. When you're talking about aesthetics, it is an emotional decision. It's not that somebody, got in a car accident. This is a want, not necessarily a need. You need to get back to them when you have them hot as quickly as possible. You need to look at your no-show rate, and you need to figure out how you can improve that no-show rate. Again, when you're talking about an average lifetime value of $90,000, to 120, if you improve your no-show rate just a few percentage points, that creates a massive amount of revenue to your practice over that patient's lifetime. You also need to look at your profitability by service or procedure. You need to know how much you're making for breast augmentation compared to how much you're making your profitability for breast augmentation towards against your profitability of a facelift or rhinoplasty or injectables, and think, where are you the most profitable? Where should you be spending your money on your marketing? We've seen a lot of practices that are spending money marketing things that aren't really that profitable to them, and they think, okay, well, it's going to generate more revenue. Right now, we need to be looking at profitability. When we're coming out of this, you need to be looking at profitability. So you need to be figuring out where you can make the most profits with the services that you're doing and marketing correctly. And you need to look at revenue per customer, per patient, which again goes into lifetime value. It helps you understand the value of every patient. It helps everyone in your office needs to understand the value of every patient. So conversion rate is absolutely critical, and you need to understand it, because if you don't understand it and set goals about it, you cannot improve. You are a sales organization. Everyone who comes in is an opportunity to create revenue for your office. So you need to know how many leads you need to fill your calendar. And if you're not doing the things to get those leads, you need to be analyzing what could you be doing better with your marketing to be getting more leads in your office. You need to also be looking at how you're treating patients. How are your reviews? Are they referring a lot of patients to you? Are you incentivizing your patients to refer business to you? Your patient base should be your biggest referral source. More patients should come from them than anything else you're doing. And if it's not really happening, you need to look at what are you doing in your office that's not incentivizing people to generate patients for you, to be referring their friends to you. You need to look at your schedule to surgery procedure rate. When people come in, when you have consultations with them, are they scheduling? Are enough of them scheduling? If not, you need to analyze what's happening. You need to be talking to your patient coordinator, figuring out where you guys can improve that conversion rate. And again, what is your close rate? How many people are finishing, coming in, getting surgery done? How can you improve that? What steps can you take in the office to improve that closure rate? And also, how do we shorten that sales cycle? If you're seeing the average breast augmentation patients taking 60 days, what can you do? Can you be emailing them? Can you be calling them? Can you be offering them another incentive to do it quicker? What I've seen a lot of practices have success with during these shutdowns is offering a great deal. If somebody gives a deposit right now, maybe you get $4,000 in procedure for $3,500 if you give a $750 deposit right now. They're creating cash flow to the office through this. And then that patient, when they come in, they're filling their surgery schedule, and they're also creating those walking billboards, which every patient could be, so they're referring more business to you. And cut unnecessary expenses. We've really taken huge efforts to cut unnecessary expenses, streamline things in our office, which makes us more profitable. You have to also, so you need to look at everything you're doing in your office and figuring out what you can cut without taking service down a level at all, while maintaining the same service levels. You need to know what your cash is, what your burn rate is, determine where you can cut costs. It's a great time to analyze this. A lot of my clients have been looking at this, and they're seeing a lot of waste in their office, things they can be doing better, things they can be more efficient at, making them a more profitable practice, making them a leaner practice, and making them a better practice and in a better cash position. So you also want to identify your options and opportunities. Charles Swindoll said, "We are all faced with a series of great opportunities, brilliantly disguised as impossible situations." That is what we are in right now. A lot of people have buried their heads in the sand and thinking that this is an impossible situation. But really, this is an opportunity to capture market share. While your competition is not doing anything, you can be doing things to jump ahead right now. So you want to identify, again, your true profit centers in your office and figure out where you can cut expenses. And then you can market yourself well during this for the right procedures that are your profit centers and create more revenue in your office. For every $2 you're cutting in expenses, throw $1 into your marketing, whatever marketing that is working for you. I have numerous examples. I'm not going to go through them all right now, but there's numerous examples of companies that have thrived during the depression, the recessions, have come out and captured market share when their competition was not doing anything to market, was cutting back on their marketing. The companies that were doing correct marketing, capturing market share, and grew tremendously and came out of this very, very, very strong. And you got to realize, as Dr. Shridharani said, people are going to spend money on aesthetics. I always ask when I'm lecturing to aesthetic providers, what do you cure? And the answer is you cure depression. And right now, more people are depressed than ever. They will spend money on aesthetic services. I've been fortunate to share podium with Kent Remington, who's a wonderful injector out of Canada. And if you can ever see him speak, it's absolutely just incredible, both from an injection perspective and a business perspective. But one of the things he talks about is the socioeconomics of his patient base. And he shows slides where he shows this patient is a postal worker making 36,000 Canadian, and she spends 2,700 of that per year with me. People will spend money with their aesthetic providers. They will always spend money to look better, for you to cure their depression. So a great thing to do is be ready for this. When you can open back up, you need to work through your backlog, and there's great opportunities for you to take the people that have already been in your office or that have already made appointments and bring them in as patients. You need to be looking at how you're going to prioritize your workload, and because if you're not ready for this, they're going to go somewhere else. And there will be a surge, as Dr. Shridharani said, and Dr. Bucay said, she's full. There is going to be a surge. You need to be working to fill in a gap right now. Focus on the profitable procedures first, and then you can focus on the other ones. So you should be calling, texting, emailing any customers or patient that was canceled because of this. You should be the whole time, even if you don't know when you're going to open up. You should be keeping in touch with them, touching base with them, letting them know that they're a priority for you as soon as you open up. You don't want them looking elsewhere, hearing about any other provider and switching things. And again, if you can offer them some type of discount to put a deposit down now for their procedure at a later date, you're going to lock them in, you're going to create cash flow for your office as well. Call or text any patient that's overdue for their Botox, for their fillers, for their neuromodulators. We know, I mean, everyone's been talking about this nonstop, how their faces are falling during all this. They're going to want to get back in. People are going to be advertising. They are going to be doing pay-per-click. Everyone knows there's going to be a ton of people, and the smart marketers are going to be going after them big time. You need to put yourself in position to not only keep your patient base, but capture market share from the competition. You want to update your database of contacts, make sure you have everyone's email address, make sure you have their cell phone numbers, call, touch base. It's also a great time if you know when your patient coordinator is calling patients to check in, and you know they're a happy patient, you could say to them also, look, right now, because we don't have any patients, reviews have really slowed down. If you have a moment, would you mind going on and giving us a review? You can use a system. We have a system. There's lots of systems where you can text them links to your reviews. Really, really smart thing to build those up right now. It's also a great time to be training your staff, to be doing all the things that you've been putting off. So many times I'll meet with doctors and they'll come to us for their website. We'll look at their existing website and they'll say things like, I haven't updated my content in forever. I haven't updated my before and after photos. My before and after photos are much bigger, better than these. These are all 10 years old. Well, now's the time to be going through and doing things like that. Updating your content, writing new content, writing questions and answers, going through your before and after photos, updating them. If you don't have a before and after gallery, now's the time to get one on your website because it's the first place aesthetic patients go on your website. Get new great pictures in. Think about how you're going to be taking pictures and improve that so you have good, consistent imagery. They're all things that make aesthetic patients convert. Photos are absolutely critical. Again, emotional decision. Photos drive emotion. Photos change body chemistry. Photos make people feel better about you. Goals and OKRs. This is really, really critical. This is what has helped so many companies, including our company, really grow. People with goals succeed because they know where they're going. That's from Earl Nightingale. John Doerr, who was at Intel during its tremendous growth, his mentor was a man named Andy Grove, who was one of the original mentors at Google. And he came up with this OKR concept. John Doerr really took it and took it to a much, much higher level. He wrote a great book called Measure What Matters. Everyone in our company has this book. They're giving it to it when they join our company. I highly recommend after this, you go get Measure What Matters. It is critical to your growth. If you really want to grow, this is the way you do it. So first of all, you have to ask yourself why. Why do we want to grow? What do we want to achieve? This is going to go into your objectives and key results. When you help your team understand that, you're going to create alignment across your entire organization. OKRs provide the what and the how to grow your business. OKRs provide clarity of purpose. The most talented people want an aspiration that is inspiring. Laszlo Bock from Google. So OKRs demand, why are we doing this work? That's where the mission statement comes in. A well-communicated mission only motivates a team, but also helps evaluate goals on whether they link with the team's collective values. Again, 75% of employees feel disconnected. Having correct goals, having OKRs allow us to achieve growth and get everyone involved in the company. So OKRs have helped lead us, this is from Larry Page at Google. OKRs have helped lead us to 10 times growth many times over. They've helped make our crazily bold mission of organizing the world's information perhaps even achievable. They've kept me and the rest of the company on time and on track when it mattered most. So again, highly recommend, read, measure what matters, but also listen to the book. Go on Audible or whatever app you use, listen to the book, because in the book, you have Larry Page's being interviewed and explaining what this meant to him. You have Bono, you have Bill Gates, you have Andy Grove in their own words talking about how impactful on their ridiculous growth of all those and many others has been because of setting good OKRs. So an objective creates the what, the goal, the key results create the why. An objective is the goal, the what or direction of the organization intends to work toward. You want it to be a clear and concise statement. I'm going to show you, and also you're going to set not only your objective, but your key results, OKRs. Key results are the metrics, the how, to determine how an objective is met, usually 3 to 5 key results. When we originally started, we had a lot more things we wanted in our key results. We realized you need to pare it down. You need to have specific key results. And I'm going to give you some examples. So if you think about an NFL team, at the top you have your general manager. His objective, make money for the owners. That's his goal, make money for the owners. Key results are win the Super Bowl and fill the stands to 88% capacity. But if you look at those key results, the first one, win the Super Bowl, that becomes the objective for the coach. The head coach's goal or objective, win the Super Bowl. His key results, in order, how is he going to get there? Remember, the objective is the what. The key results are the why. His key results would be 250 yards passing per game, number 3 in defensive stats, average 120 yards per game, plus 12 turnover ratio. All those become the objective of the offensive coach, the passing coach, the quarterbacks, the defenders, the defensive coach. From our perspective, or from a medical practice, again, you want a top-down approach. Let's say your objective, increase revenue from 3 million to 5 million. And then what you want to do here is really set your SMART goals, specific, measurable, reportable, timely goals on your key results. So here we have increased revenue from 3 million to 5 million. How are we going to do that? We're going to hold quarterly sale events in the office. That's going to be someone else's, one of their objectives. We're going to increase upsells and cross sells from this number to this number by this date. Okay, measurable. We're going to add 4 new surgical cases every month. Now that doesn't seem like a lot, but if you think maybe the average is, let's say $5,000, that's $20,000 extra revenue per month. That's $240,000 extra revenue per year. But you've added now 48 new patients. And if you think lifetime value is 90 to 120,000 for a plastic surgeon, that revenue is staggering. And when you're doing that every single year by just adding 4 new patients a month, you're changing your life. You're changing your retirement. You're changing everything just by that small 4 new surgeries a month, making that small, achieving that small key result. But if you don't set them, they're never going to happen. If people don't know where they're going, they don't have a vector. So you need to set these objectives, set these key results. It also transforms your whole practice. When people feel like they're part of something bigger, when they realize that what they are doing matters, it makes everyone feel connected. You got to have that transparency so everyone sees what their effect is on everyone else. It removes those silos. I couldn't do this because of this. No, here's the numbers. This is what's happening. This is what you're doing. This is how it affects. It helps people because they feel part of a team. They're going to collaborate with each other. They all want to improve. It's going to create teamwork and a common purpose. And it also has accountability. The numbers are the numbers. This is what it is. You're doing what you're supposed to do or you're not. If not, why didn't you do it? Let's help you improve. You need to be looking at them all the time. Higher productivity, trust, all things that come from setting and living OKRs in your company. Those have helped us grow, as I said, to, we've seen fabulous growth in our company. I mean, in 5 years, we've gone from about 12 employees to over 100 employees, from maybe 150 clients to over 2,000 clients. And it doesn't just happen. It's you work hard, you set goals, you measure those goals, you look at those goals, why you achieve them, why you don't achieve them, and figure out what's happening in your company. We have a great culture, wonderful people in our company. When I used to tell people, visit our offices at any time just to see how great our employees are, how the vibe that we have. And it's because we've set these type of things. Hopefully we can get back to where I can invite people to come to our offices again. You need to implement your plan. Steve Jobs said, to me, ideas are worth nothing unless executed. They are just a multiplier. Execution is worth millions. To him, it's actually worth billions, and eventually out will be with trillions. So what have we done to do this? We have created tremendous assets for you, because you might be wondering what we can do now. How do we do this? At Advice Media, and I'll send all of you this, we've created an incredible white paper on a COVID recovery plan for businesses. We've created a series of videos, emails, websites, social media resources. If you go on our YouTube, you will see our whole COVID recovery section, which has tons of great information. It actually has this presentation, but expanded to give you massive amounts of information. We will help you also. You can, we're not going to set up your mission statement, but we will guide you. There's information on how to do that on there. If you want to call me, email me for information, we're here for you. We are a resource for everyone to get through this together. So again, your next steps are setting your mission and values, looking at knowing your numbers, identifying your options and opportunities, setting your goals and OKRs, and implementing that plan. The key is consistency. You have to do it. You have to work at it. It doesn't happen overnight, but one thing I always say when I'm talking about social media, my social media lectures, patience equals patience. Do it consistently, and you will create an incredible business. You will create incredible growth. If you don't, there's no way it's going to happen. All right. Thank you to all the speakers. Michael, I'm going to turn it back over to you.
Awesome. Thanks, Darren. That's awesome. That's an excellent presentation. I think resonates across each level of our industry. And Eclipse definitely has seen that transformation. And Dr. Bucay knew Eclipse really when we had our origins in the sort of energy-based device world. First as a regional distributor for Luminous. And it was a challenge just like this back in 2008, where the financial system started to experience cracks. And we were not immune to that. So really our mission today that us and the version of Eclipse that was born out of that kind of adversity, where we pivoted and have been committed to a new mission of bringing affordable technologies that exceed patient expectations for results. If we can stay in that lane, we know we're going to have something of value for doctors and patients, no matter what challenges are thrown at us. And amen to the OKRs. We were latecomers to the OKR game. We were looking at things from a different way, and OKRs have transformed our business. And I think when I saw Measure What Matters on the COVID-19 comeback plan, I thought, I got to reach out to Darren. These guys are like-minded. We can put something valuable together. So appreciate that presentation. So I think Chad has been collecting questions, or maybe Darren, you can see the questions.
I've got him here.
Excellent. So feel free to just fire the most relevant ones off, and we'll go from there.
Perfect. So Dr. Bucay, I'm going to back up on a couple of questions for you. One of the questions was, with masks, how do you treat the lower third of the face and lips?
So that's a great question, and that's the question that I also had. So going back to the guidelines, The patient, once the patient removes the mask, then you as a physician have to have extra gear in place. And for that, I'll have an N95 mask, and I'll have a face shield, or at least wraparound goggles, and minimize the amount of time spent. So once the patient removes the mask, I'm at higher risk, so I need to step up my gear. If I'm injecting a neuromodulator, let's say, that's very quick, and let's say I'm doing upper face, and the patient still has their regular mask on, I can then keep on like a 3-ply mask. But to treat the lower third of the face, then I have to increase the level of protection I as the injector have. And at that point, hopefully, we'll not even have an assistant in the room.
Great. Thank you. Dr. Shridharani, question is, when do you expect New York City to open back up for cosmetic office visits?
Oh, gosh, I wish I had the answer to that. Certainly what the expectation is, there's been a lot of different dates that have thrown out there. First of all, April 29th was when elective surgery resumed in New York City, but then there's some stipulations based on the county, based on the number of cases and the percentage of decline or the plateauing effect. So, I mean, it could be as early as not this coming Monday, but the following Monday, so meaning after the weekend of the 16th, or there's also discussion of the stay-at-home order until June 1. So, I mean, we certainly know that the earliest it'll be mid-May, but there's a chance it could be as early as late as the first week of June. So it's still going to be, we're still kind of under lock and key.
Wow. Yeah, that's it's crazy. We're supposed to be out in New York City the first week in July for a dance competition and take my daughter out there for kind of graduation gift. She's graduating high school, and we're just having to make new plans right now. So everything's changing, especially in New York City. And New York City is different than where we're at here in Utah. And I think that's what's been interesting about this as well, is the regionality of everything that's happening. So it's, every area is unique. Dr. Bucay, there were a couple requests for the article you mentioned on the 1-hour simmer and the safety guidelines. Is that something that we can provide to our attendees, here soon?
Yeah, I think it's going to be. Yeah, I will. I'm going to email the link to internally to our to the group, those of us, and then you all can forward it out. You can provide it to the patients, the attendees who request it. It's going to be in press, so it's already been. I guess there's an e-publication, or it's coming up. So I know that that I have that. I don't think it's secret that way.
Good. Perfect. Thank you. And for both of you, and let you answer this, but the question was, besides mask, would you also recommend booties and/or caps for patients, and would your office provide those?
Yeah, I mean, at least in our office, I don't necessarily think that the caps and the booties are necessary. I think we're looking more at the lens of what can be aerosolized and transferred from a respiratory lens, as opposed to them needing to protect us providing them with footwear or hair. I think if we're at that level of concern, then they probably shouldn't be in the office at all, unless they're coming in for some type of oncologic or reconstructive purposes, or something beyond the scope of elective aesthetic, when you start worrying about having to have their shoes covered and their hair covered. And then do you need to provide them with gloves also? Where does it end? Why the shoes and why the hair?
I'm going to jump in and say that I'm in complete agreement. And one of the things we're doing when we screen patients is, if I have patients, let's say, that have autoimmune diseases that require, they're on high dose steroids, or they're on immunosuppressants like azathioprine or something like that, I'm not going to schedule them anyway, because they're already patients at higher risk that I know how much they miss their injectables and want to feel better, but why subject them to higher risk? So, we have that ability to kind of triage and hopefully, optimize our schedules with patients that are already at their healthiest to start. And I agree with what was said earlier, is also strategize what you are, how you're scheduling patients. So no masks, or yes to masks, but no to hair coverings and booties if it's something that I wouldn't do anyway.
Excellent. Couple other questions. One of the questions that came up, and both of you can answer this, is your thoughts about injecting fillers, especially given the rise of granulomas and the expectation to wear a mask. I think we've talked about the mask extensively, but the rise of granulomas.
Who wants to take that one? You want me to take that first? I'll take it first. So
Sure.
I think it depends. It depends. I do a lot of fillers. So I really think it depends on the technology behind the filler. I would say that if anybody bought into the idea that not having proper cleansing and hygiene prior to, patients come in with makeup or whatnot, but let's just assume that all things being equal, we're probably going to have much more heightened measures of hygiene when treating our patients. That's just to start with. So I'm already asking them to not come in with makeup or anything like that to help us in cleaning out. And then choosing the filler, if you personally, and I'm not here to talk about one filler or another, but if there is one type of filler that has a higher association of nodules, then I would say, avoid that. Don't use that. There's plenty of fillers to go around. I'm more about avoiding procedures that require a lot of touching the face afterwards to take care of, post, because you're trying to minimize the amount of time that, there are people touching their faces. Also, if they have to wear a mask to go to the grocery store or the pharmacy, and you did, some type of, a medium depth peel or a CO2 laser resurfacing, it's going to be harder for them to wear that. Their skin's going to be more irritated.
It's music to our ears, actually, because we've really honed in on microneedling, and with PRP being sort of low or no downtime procedures. We couldn't have anticipated what we're experiencing now, but we definitely thought, the economic impact of, sort of your high ticket items and any sort of pullback. Every economic cycle has a bubble that bursts. I don't think anyone could have anticipated what we're experiencing now, but we're fortunate that we're in a position where doctors have either a $50 or $50 cartridge to purchase, or a $100 or $150 PRP kit. These are things that help you profit as you go. And I anticipate, based on your previous comments about bladed procedures and high downtime things, are you finding also that a lot of the disposable type of procedures that whether it's fillers or toxins or PRP, that those are also the more profitable things to do with each hour of your time?
I think that really depends. Oh, go ahead.
No, it's totally fine. I mean, we're accustomed in the surgical world to obviously doing some, again, more expensive, larger type procedures. But what we're finding time and time again, number one, are including injectables or procedures that I do, they can be highly profitable from that lens. And certainly the microneedling element, things that I delegate to colleagues in my practice, my employees that are very skilled, have a phenomenal ability to generate nearly physician type revenue that otherwise we wouldn't be able to. Plus, they have a larger and lengthier touch point with the patient that I may potentially have the ability to do. So their ability to connect with them, help them understand. We've had patients that may be going to a different surgical practice or heard of a different practice for a breast dog in New York, but now they're so keen on the skincare and the microneedling they're getting with our team that they're like, wow, they're so comprehensive. And I didn't realize Dr. Shridharani does so many of those. I thought he was a great facelift surgeon, but wow, all of a sudden they want to do their breast augmentation there because they've had multiple hours, multiple touch points, building a great communication with our team. So I think it all pools in and is definitely been worthwhile in adding those elements and encouraging patients to undergo them because of the outcomes and the touch points.
I couldn't agree with you more. And, it's interesting because I always figure, well, I'm the leader of the group. I founded it. I generate, a larger portion of revenue, et cetera. But I have two estheticians and associate who are amazing. And it's interesting, they will go to one of our estheticians, let's say for cool sculpting or some other body contouring. And because they had such a great experience with her, they will now come to me for injectables, whereas they were going somewhere else. So a lot of, having staff in place that can really credential you, but, that can also provide an incredible experience in, being like-minded. Again, that all goes back to your mission and your vision and values. It really does guide your practice. I think that really helps a lot. Back to 2008, my experience was different as a dermatologist because we were still able to work. People had less disposable income, but they wanted to spend. So we were still doing smaller procedures, and our practice actually grew. This time, nobody can go to work. And so you've got the inventory there. So we're ready. I mean, there's inventory we already had. We're ready to go back. And now that people are going to be, anxious and eager to get out of their homes, for some people that were in a decent financial position before all of this happened, they're just ready to go back out and spend what they already, what they already have or what they had already allotted. So I would say that this situation, although it's been devastating and the amount of unemployment that's been filed is crazy, overall, we were in a better state, in a better position when, this all came down, and it was, flat out across the board. So I'm optimistic. I think it's going to take several months, but I'm definitely optimistic that we're going to be, once we're in a position that we can actually be, doing what we do, the recovery should be faster.
Yeah. Awesome.
Definitely. We're all in this together. I know companies are working with providers right now, just the only way we really can, which is to provide great deals, sort of like what you're talking about, putting deposits on procedures at a discount. We're definitely doing that. And we do have some of our promotional offers up. And this is one of those things where if you're in a position to do this, it'll be to your advantage in the future. But at this point, our reps are adjusting to Zoom. We're learning that it's actually a pretty good way to communicate with doctors, as you guys are so busy as it is anyway. And so we're in this really no pressure type of world, but we do want to provide something with our services and partner with Advice Media as well. So if you see what we have posted up here, there's just some discounts. If you want to connect with Advice, you'll get a 20% off their services. We're going to send everybody out a survey just with some questions after this. The recording will be placed. I think Advice will have it posted somewhere. Eclipse will have it posted somewhere. So whether you're an Advice customer or an Eclipse customer, we'll be able to put this in front of you again if you want to go back and reference it. And I think Darren had one more comment before we.
There are a couple more questions. Well, I wanted to add on to what you said again. Yes, Advice Media. If you're an Eclipse customer, not familiar with us, we are a digital marketing agency. We handle the web presence of over 2,000 medical practices, most of them in some type of aesthetics. We do the websites, review generation, search engine optimization, social media, pay-per-click, everything. So we are here for you. If you need any guidance, if you need any help, we handle all kinds of practices, from the nurse injector starting her own to huge universities and KOLs like the two that spoke today. But I know we have a couple more questions that I want to get to that came in. Chad?
Yeah, I think based on the time and looking at these questions, everyone, they're fairly similar to what we've answered, and so I think we're in good shape. We certainly appreciate Dr. Bucay and Dr. Shridharani for their time, and don't want to abuse that. If there's something specific that somebody would like, they could certainly email them, or we can put them in contact with the doctors. And Mike, thanks to you as well. Darren, thank you for your message. We want to wish everyone the very best at whatever phase you are in right now in your practice of getting either reopened or opening soon. We know it's not easy. I've heard it said that we're in the storm together, and I like that better than the other one, because we're all different phases, but we're all facing a storm. And my wife was telling me the other day, she said, I like the buffalo. I was studying buffaloes face the storm head on. And I think that's where we're at. We're with a very like-minded group of individuals that are facing this head on, and we're going to get through this together. And so let's be like the buffalo. We're going to stay strong and continue to share ideas and concepts to help one another. We appreciate all of you, and we wish you all the best. Take care.
Thank you.
Thank
everybody.
you. Bye-bye. Thanks.
Happy Cinco de Mayo.
Happy Cinco de Mayo toast, a virtual toast.
Salud.
Yes.
That was it.